Good day, I'm Nika Anderson-Isaacs, Communications Officer within the Ministry of Health, Wellness and the Environment. Today we'll be doing key interviews with persons represented at the OECS Multi-Country Strategic Response Training towards the reduction and elimination of HIV, AIDS and tuberculosis. Stay tuned for so much more in this section with us. So I'm here with Miss Lynette Hardy, and she's a project officer with this project. Can you tell us a little bit more about the project itself and why it is important?
Well, this project is important because the main focus of this project is about health system strengthening. And coming out of that, we're speaking about strengthening your lab services, strengthening your clinical services, and more importantly, getting the key population involved within this process. Because it has been found time and time again within the OECS and the wider Caribbean that the key population are the group of persons that really don't have much access, or because of reasons unknown to us, they have not been able to have the maximum capacity of access to care and treatment within the region.
Okay. What encouragement would you give to persons, or why would you say to them that it is important to have a multi-country and not just a multi-sectoral approach, but a multi-country approach to the elimination of HIV and TB?
We always have to remember that individually we're very small in numbers, and we have to find a way of creating synergies in an effort to move forward, so that we can see some development in our healthcare system and the strengthening of the services that we provide. We also have to look to see which country has speciality in a certain areas, and so if one country has some specialist services, the other countries can benefit from that. Every country will not be able to introduce some special services, but we can benefit from each other by working together. So it has become more important now than ever because funding is drying up. There's very limited funding available from the international agencies, and very soon we'll have to look for other avenues rather than the regular agencies that we've been securing funding from.
Okay. What word of encouragement would you give to persons out there who may be watching this interview in terms of their sexual health?
I would like to say knowledge is out there. Most of us have a cell phone, most of us have access to the internet. We have to make these media, social media, whatever we use, work for us in a constructive way. So we can go on social media, we can ask our peers questions, we can post interesting topics, and I'm sure you will get positive answers about different areas, about your sexuality, about sexual and reproductive health. Knowledge is out there, and it's ever so accessible now, more so than in the past. And the language that people are using, it's easy for us to understand the terms and the meanings, more about our body and how we can take care of ourselves. So that, like I'm saying, knowledge is out there. It's easier this time around to access the knowledge and the information, and we should let those mediums that we use, more importantly social media, work for us. Post our questions, post comments, and be very constructive on how we use social media.
Okay, thank you so much.